Good morning, everyone, and thank you for being here today on the unceded and unsurrendered traditional territory of the Anishinaabe Algonquin Nation. My name is Dr. Jaipaul Parmar, Board Chair of the Canadian Chiropractic Association, representing almost 9,000 doctors of chiropractic across the country. I am also a practicing chiropractor in Vancouver, British Columbia. Today, I would like to raise awareness about an important issue affecting my patients and Canadians living with chronic pain and disability, the disability tax credit. Despite our clinical expertise, chiropractors remain excluded from certifying applications for the DTC. This is creating unnecessary barriers for patients who are already navigating difficult circumstances. This discussion is about access, fairness, and modernizing healthcare policy to reflect the realities of patient care in Canada today. When we look at the DTC categories, with walking disabilities and mobility are the second largest area where Canadians need support. According to the Canada Revenue Agency's 2024 statistics, about 670,000 Canadians hold the DTC certificate, setting a walking restriction second only to mental functions. These are exactly the kinds of functional limitations chiropractors assess every day in clinic, from mobility challenges to chronic pain and musculoskeletal conditions. That is why chiropractors are well positioned to be recognized as qualified providers in the process. Providers with overlapping scopes of practice, including physiotherapists and occupational therapists, already certify mobility-related impairments. That makes the continued exclusion of chiropractors who assess these same limitations every day all the harder to justify. For many of us here today, we do not think twice about our ability to walk up to this podium, walk to the restroom, or walk in the park with our children. But for hundreds of thousands of Canadians, that is not their daily reality. For them, mobility is something that they cannot take for granted, and access to timely support can make a meaningful difference. I am seeing these patients, and when they need the DTC form completed, I cannot complete it for them. And they must make an appointment with their family physician or another provider, adding more time and creating an unnecessary step. It is time to update the DTC application process and include chiropractors to certify these applications. This is practical, patient-centered issue, and one that deserves attention. It is now my pleasure to introduce the CEO of the Canadian Chiropractic Association, Dr. Ayla Azad, to speak further on this issue.
Thank you. Good morning, and thank you, Jaipaul. I am the CEO of the Canadian Chiropractic Association and also a practicing chiropractor. This is a clear and fixable gap in our healthcare system, one that is creating unnecessary barriers for patients and adding pressure to an already strained system. And I, along with the thousands of our members across the country, have also seen this firsthand in our practices. We are calling for a very practical change to allow chiropractors to certify applications for the disability tax credit. Why are chiropractors, who are trusted by millions of Canadians, relied upon by families every day, referred to by physicians and other healthcare providers across the country, why are we still excluded from parts of the healthcare system in ways that no longer make sense for our patients? This is not about politics or professional turf or expanding scope. It is about modernizing outdated policies that do not serve Canadians. This is about fairness in healthcare, fairness that leads to improved patient support, and it is about Canadians who are being forced to navigate unnecessary barriers while living with chronic pain and disability. Every day in Canada, doctors of chiropractic assess functional limitations, diagnose musculoskeletal conditions, and manage these conditions, including chronic pain and other issues that affect a person's ability to work, move, sleep, and participate fully in life. Despite that reality, chiropractors are still excluded from certifying DTC applications, even when we are often the healthcare provider most familiar with the patient's condition and those functional limitations. So what happens? As Dr. Parmar mentioned, a patient who is already receiving ongoing care from a chiropractor must then try to find another healthcare provider, such as a medical doctor or nurse, simply to complete paperwork. That means more waiting, more appointments, more delays, and more frustration, and in many cases, more cost and stress for someone who is already struggling. We know that some Canadians do not have access to family doctors. Emergency rooms are already overwhelmed, and governments are asking healthcare systems to work smarter. So why are patients still being forced through additional administrative hoops that serve no clinical purpose? It is inconsistent and inefficient and reflects an outdated view of healthcare delivery in Canada. Given our expertise and accountability, chiropractors should be permitted to complete DTC applications for the patients they already assess and care for. Let me also provide the viewpoint from a patient's perspective and what I have personally heard from patients. Chiropractors are recognized as regulated healthcare providers when they need treatment, but when those same patients who are receiving our treatment require access to federal supports, suddenly that professional recognition disappears. And it is patients who pay the price for that inconsistency, and they do not understand why. That inconsistency is what our proposal is designed to fix. It would recognize qualified providers based on competency, regulation, and the care they already provide without increasing costs to government. There is no clear clinical reason to maintain this barrier. If the government is serious about patient-centered care, reducing unnecessary administrative burden, and improving access to supports, then this policy should be modernized. We are encouraged that organizations like the Canadian Medical Association and Disability Without Poverty also understand the importance of reducing unnecessary barriers for patients. Our ask is simple. Modernize the DTC application process so chiropractors can certify applications within their scope of expertise. Updating this policy would remove an unnecessary step for Canadians living with chronic pain, disability, and mobility challenges, while better reflecting the care patients are already receiving in communities across the country. Canadians deserve a healthcare system that reflects the realities of today and not the barriers of yesterday. Thank you so much, and we're happy to take any questions.
Thank you. I don't see any question online or in the room, so that will conclude the press conference. Thank you.
Thank you.